My name is Dr. Derek Wu. I'm a board-certified anesthesiologist here in Northern California. I started my education at the University of California, Berkeley, where I double majored in biochemistry and psychology. After college, I actually took a couple years off. I worked for a little bit doing MCAT education and MCAT instruction and test prep. And then after that, I worked in pharmaceutical clinical trials. I started medical school at the University of California, Irvine School of Medicine, during which I did get voted to be class president my final year. During my medical school time, I was involved with medical school admissions as a student interviewer, as well as a student reviewer of applications. We assisted our admissions committee in vetting some of our applications, as well as speaking to prospective students who came through. After residency, I completed an internship in Long Beach at a small hospital. It was a medicine internship during which I was named Critical Care Intern of the Year. After this, I was at the University of California, San Diego for anesthesia residency. I was chief resident 2 years running. During residency, we were closely involved in the residency selection process. Once again, I was assisting our faculty in reviewing applications, speaking to prospective applicants, as well as doing outreach as a program, outreaching to highly qualified, very, very accomplished residency applicants. I am currently Assistant Chief of Anesthesiology here in a hospital in Northern California. I am the Medical Director for Outpatient Surgery, as well as the Director of Procedural Sedation. I am involved in our Physician Recruitment Committee, as well as our Physician Retention Committee, where as an early career physician, I am involved in coming up with ways that we can recruit better physicians to our medical center, as well as keep them once they are here. On the side, I do lots of department education, both clinical and non-clinical, on topics of anesthesia as well as perioperative care. And I am closely involved in residency outreach, both to my alma mater at UCSD, as well as some of the other Northern California anesthesia residency programs, where my goal is to educate residents on professional development, career choice, job selection, and things like that. In medical school, I was named class president with another colleague of mine. We worked closely with our faculty in just helping improve the medical school experience, thinking about things like flipped classroom and curriculum development for medical students, and things like that. And then finally, as a resident, I was chief resident, both starting with an educational chief resident, my CA2 year, followed by just a, regular chief resident, my CA3 year. Again, working closely with faculty, being a leader, leading my residency class. I think the key to success in medical school is knowing thyself. Some of the medical school admissions process, the length of medical training in and of itself, I think is designed to help applicants and those who are in it learn about themselves, learn about what makes them passionate for medicine, and it's important as an applicant to realize that for yourself, to be honest with yourself. What are my strengths? What are my weaknesses? Some of that can be academic, some of that can be test scores, some of that can be experiences. And the sooner and quicker a candidate or a client can come to terms with the truth of who they are, what their strengths are, that is the key to identifying those, to working on weaknesses and becoming the best medical school applicant, then student, then residency applicant, then resident, and then finally becoming a doctor. I think what's unique about me is just my whole process. I have a 360-degree view of this entire process. I was a medical student. I became a resident. I succeeded as a medical student, succeeded as a resident, and I'm now an early career practicing board-certified anesthesiologist. I've seen what it takes to succeed at all levels, and I think that's a perspective that is unique for me. I've always had a passion for mentorship, for coaching, for speaking with those, a couple steps behind me. And now that I'm here, I want to give back. And I think my personal experience as the person going through it, as well as sort of professional involvement in the selection process, makes me uniquely proportioned and uniquely insightful into the entire process. I bring perspective to this role. It's not just about getting into medical school, it's getting into the right medical school. It's then succeeding each step of the way with the ultimate goal of becoming a practicing physician. I think one of my greatest strengths, in addition to just context and having good context into the whole process, is I'm a natural teacher and a natural leader. I've had leadership experience at every level, even now as a practicing physician. Teaching has always been my passion. I started teaching chemistry as an undergrad, and I've taught the entire way, even today, teaching some of my colleagues here. We work with nurse anesthetists, and I'm constantly teaching. The role of being a physician is to teach. So I do think I have unique teaching skills. I have unique leadership skills and mentorship skills that cannot be replicated easily. Some of this was just born out of years and years of training, quite literally. Because this process is so hard. This entire process of becoming a physician is incredibly hard. And I myself did not have that much support. And this is an opportunity for me to give back. This is an opportunity for me to teach others my mistakes, teach others my successes. And, mentorship is, to me, very rewarding. I love seeing success stories. I love hearing about success stories. That's something that I would love to share with my clients moving forward.